welcome to the Innovations in Clinical Implementation, the Ovation Lab and A4M series focused on helping practitioners bringing cutting-edge clinical tools directly into their workflows. We're live here at LongevityFest 2025, joined by thousands, 8,000 practitioners to be exact, of clinicians advancing whole person, systems-based care. I'm Lexi Gonzales, a naturopathic doctor and senior clinical implementation specialist at Ovation Lab, and I'm joined by Dr. Kosinski, Dr. Grady, and Dr. Messier today. So today we're speaking about how Jona is reshaping GI testing, not by replacing existing tests, but by enhancing how clinicians interpret gut-related symptoms, functional patterns, and systems-wide drivers of disease. Jona integrates seamlessly into current workflows and helps providers move from symptoms to systems with clarity and confidence. Dr. Helen Messier is joining us today. She served as the Chief Medical and Science Officer at Fountain Life, where she led clinical and scientific programs focused on proactive, data-driven longevity care. A physician and molecular immunologist, she specializes in integrating multi-omic data and digital health technologies into real-world practice to close the translational gap in medicine. Dr. Messier has founded a national network of concierge medical practices in Canada and previously served as the medical director of genomics at Human Longevity Incorporated and the founding chief medical officer of Viome. Dr. Leo Grady is the founder and CEO of Jona, a microbiome company using AI and digital twin technology to decode and reshape the gut microbiome for better health. An internationally recognized leader in applying AI in healthcare, he has spent more than 20 years building and commercializing advanced machine learning, medical imaging, and digital health technologies at companies like Siemens, HeartFlow, and as CEO of Page.ai, where he led the team that achieved the first ever FDA approval for an AI product in pathology. Dr. Grady has authored 2 books on AI, published over 100 peer-reviewed papers, and is an inventor on more than 300 patents. Last but not least, Dr. Larry Kosinski is a gastroenterologist, healthcare innovator, and founder and chief medical officer of Sonar MD, a value-based care coordination company for patients with complex chronic gut conditions. After 35 years in GI practice, during which he built the Illinois Gastroenterology Group into the largest GI practice in Illinois, he has become a national leader in advanced payment models and value-based care, serving on the HHS Physician-Focused Payment Model Technical Advisory Committee in the American Gastroenterological Association's leadership councils. Dr. Kosinski is also the host of the Scope with Dr. K podcast, where he explores how to bring patients, providers, plans, and payers together to transform digestive health care. Thank you all for joining us today. So I thought we could just go ahead and dive right into this idea of dysbiosis. So I'll kind of open it up to the group, but what evidence is there that dysbiosis occurs before the onset of symptomatic disease?
I'll be
Why don't you jump in? That was quite the introduction. We're like, wow.
We're still here in shock.
We're in the realm of great, so we had to give you the intro.
From the GI space, it's very clear that conditions like inflammatory bowel disease are very definitely associated with microbiome signatures. And those signatures change, whether the patient is in remission of a disease or is in flare or has been treated out of a flare and back into remission. So we can see that the microbiome change antedates the clinical expression of the exacerbation. We know that there are signatures that are associated with deterioration of metabolic associated steatotic liver disease, MASLD, into MASH. So there's really very little question that changes in the microbiome do lead the development of clinical conditions.
I love that. And you touched on both a GI-focused condition and, something that's more systemic. Dr. Messier, Dr. Grady.
Yeah, I mean, I think even back to animal studies, right, you can use and introduce a sort of a more dysbiotic organisms to mice and introduce a disease by doing that in germ-free mice, for example. That's where we've learned a lot of how the effects of changing, you can actually transfer the effects of even drugs given to one mouse into, transferring the microbiome into a germ-free mouse and getting the effects of that drug So there's a lot we've been learning from those models, and definitely the changes in the microbiome, as Dr. Kosinski said, precede the development of these diseases.
What's also interesting is you got me remembering something. Some of the phage literature in ulcerative colitis. Targeted phages can place a mouse into remission. So not only is there an association, but there could be a therapeutic aspect to it as well.
Yes, because when you target the microbiome, you're addressing the disease. So it's both, right?
And even beyond GI and metabolic disease, there have been a number of studies in Parkinson's that have shown that you have early signs of microbiome changes long before you start seeing any neurological symptoms. And furthermore, some studies have shown that if the vagus nerve gets severed, that people do not develop Parkinson's disease.
So there are, actually was diving into this a little bit. We know that some of the microbes actually produce beta amyloid and alpha synuclein that then, to your point, can travel up the vagal nerve into the brain. So, everything, GI diseases, metabolic diseases, autoimmune diseases, neurological diseases, right? When we have dysbiosis, it leads to changes in the barrier, the integrity of the microbiome of the gut, which leads to integrity barrier disruptions in the blood-brain barrier, which again drives neuroinflammation in a lot of these neurological diseases. So it's really the foundational component of most of these chronic diseases.
Right. And I feel like you're a big champion of the hallmarks of health and hallmarks of aging. And this idea of barrier dysfunction is really important.
Yes.
And so building off of that question, what is the evidence then that the microbiome plays a causal role in disease development? And can we make that jump?
The condition that points immediately in my mind is cardiovascular disease and TMAO. So trimethylamine has been proven to be a product of the fecal microbiome. And TMAO, when it's absorbed, gets oxidized in the liver, or TMA gets oxidized to TMAO. If you give a patient a porterhouse steak and you measure TMAO level, and then you give that same person that same steak after you've given them an enteric antibiotic, the TMAO levels do not rise. So it is the microbiome that has the critical effect there of converting trimethylamine into a substance that winds up being harmful.
And for those that don't know, TMAO has been shown to rapidly increase atherosclerosis development, cardiovascular disease.
Yeah, I mean, it's just, there's so much evidence, I think, by when you change, you change their treatment of the microbiome, that changes the outcome in diseases. Again, using lots of animal models, human models, it's just really so intertwined. And there's really so much, I think, evidence now that it's hard to even.
I mean, that's a functional medicine principle, right? When in doubt, start with the gut. And now we have the evidence and the tools to actually evaluate and intervene.
Absolutely.
Yeah.
As Hippocrates says, all disease begins in the gut.
Yes. It's great to be in this stage of healthcare where we actually have the technology to help us with that.
Yeah. And if, you even look at sort of the mechanisms of what the microbes do. Right.
Yes.
So it's a synergistic relationship. We've evolved with these microbes. We depend on these microbes for doing so much for us.
Yeah.
Not only, digesting, absorbing our food, but making vitamins, right? B vitamins, vitamin K are made by these microbes. They produce all of these metabolites. Take the fiber that we eat, metabolize it into short-chain fatty acids like butyrate that not only keep the integrity of the gut barrier, they actually have shown that butyrate actually heals the blood-brain barrier as well, right? Butyrate changes gene expression. So these microbes create all of these metabolites, neurotransmitters, are all of these functions come from these microbes. So it's really when it's in balance, they control our immune system, they keep it at a stage where it's ready to fight, but not too much.
Yeah.
So there's just so many beneficial things that when that gets out of balance, when those microbes become more inflammatory and more the bad guys, less the good guys, that now things are unbalanced, and over time that leads to disease.
And it's more than just associations.
Right.
The pathophysiologic channels are being elucidated. HDAC, that's stabilized by butyrate production, has those direct effects on the immune system and
histone deacetylase.
And so once we recognize these dysbiotic patterns, what can we do about it? You've mentioned a couple of things in regards to feeding the microbiome and certain behaviors or foods that may impact it. So I'm curious what clinically you have leaned on most to help impact the signature of your microbiome in your patients.
I think the biggest impact is food, is what you feed them. The microbes respond to what you feed them. And so
it's not just food for you.
It starts with, it's food for your microbes. Yeah. Absolutely. I think we need to start thinking about that. And, fiber, soluble fiber is one of the main things that the beneficial microbes will grow and eat and thrive on. The other thing that, and I think there was a study that showed, a change in diet reproducibly changed the microbiome within days.
Wow. So,
it's really encouraging, I think, is that we have that ability to influence what microbes we have just by our diet. Obviously antibiotics and other drugs will make a difference as well. The one thing I'm finding a lot of is stress.
A lot of lifestyle factors.
So I think it's maybe under-recognized the impact that stress has. We know it has an impact on the rest of the body, the inflammatory, it increases inflammation, but has a big effect on the microbiome and on the gut. And it's almost like the idea that these more pathogenic organisms, anthrax, I think, is one of them where they've done the studies, can actually sense the presence of stress in the host to know it's a good time to start growing.
Wow.
Oh, wow.
Right. So I think it's
an internal wearable.
Well, if you think about it,
feedback.
right? If you're, exactly. Like for these organisms, if you think about it, if you're a pathogenic organism and your host's immune system is in tip-top shape, might not be a good time to start trying to grow.
Right.
But if you know your host is compromised, which stress will do, suppress your immune system, that's a great time to start growing and taking over. So it's interesting to think about it that way.
I have to preface this by saying I no longer practice. I retired in 2019, but if I was still in practice, there are 3 categories in which the fecal microbiome analysis can help us. First one is the early detection of disease. Even before we do, let's say, screening tests, we've shown at Jona that we have the same percentage of patients who are positive for a signature for adenomatous polyps as there are in the general population, confirmed by colonoscopy studies. And we've compared our output against those of colonoscopy studies, bracketing the incidence of polyps by 5-year age groups, and we've got like a 94% correlation.
Wow.
The important thing here, though, is that's fine in the people over 45 who are supposed to be screened anyway. But what about those people under 45 who now 14% of all the colon cancers are arising in? What do we do with them?
Right.
Well, if I was 30 years old and I had a signature for adenomatous polyps, I would certainly want to know that so that I could alter my diet and move that signature away. So,
and potentially get a colonoscopy.
And,
yes.
of course, that goes without saying. But and then the second category that microbiome assessment can help us with is ambiguous symptoms. In practice, patients don't come in and say, "I have Crohn's disease." They come in and say, "I have abdominal pain, I have diarrhea, I have urgency, I have all these things." And do you work up every single one of them for IBD? Because they probably have IBS. But doing a microbiome signature will tend to help point you in the direction of where you should spend most of your attention. Not that it's perfect, but it certainly can lead you in the right direction. Then the final category is the management of chronic disease. And 86% of all the cost of healthcare is in the management of patients with chronic disease. And just about every patient after a certain age has at least one chronic disease. And the microbiome can assist in controlling these. It's just like what I mentioned earlier, the patients with fatty liver who go on to form steatohepatitis. I mean, that's the number one cause of liver transplant today is steatohepatitis. And so we've been able to, and pathophysiologically, we know that leaky gut leads to that formation. You can check that association. You can analyze that patient, and you know, only 1 out of every 5 people who have fatty liver go on to develop MASH. Well, maybe we can help identify which 1 out of 5 patients with fatty liver should have more of an intensive therapy. So I think those 3 buckets really can be very helpful and useful to a practicing clinician.
Well, that's a perfect transition to this next question. We started off the conference kind of defining what we think about longevity. And one of the pieces that was in that definition was this extension of health span. And so what do we know about the relationship between the microbiome and longevity?
It's actually one of the hallmarks of aging, right? Is, gut dysbiosis is one of those drivers of aging. And we know that there's definitely our microbiome changes as we get older. And we do know that that's associated with sort of disease as we get older, right? So I think it's a fundamental component of a long, healthy, both health span and lifespan.
You know, if you look at the blue zone,
yes,
all the blue zones, there's commonality amongst the diets. And it's what Helen already mentioned. It's those soluble fibers. They're different. They're tubers in Okinawa, and they're probably chickpeas in Sardinia. But they're the same thing inside the body. And they're soluble forms of fiber that go on to form short-chain fatty acids, specifically butyrate, which have been shown to stabilize our DNA, stabilize our immune system, and do all those things that are going to help us live a nice, healthy life. The thing I struggle with is I understand this. We understand this, but this is complicated for the average person. And there are no nutrition labels that tell you how much soluble fiber is in your food. They say fiber and they say sugar.
Right.
Yeah.
And the average consumer does not realize. And so
we don't know that there are multiple types of fiber.
Oh yeah,
Most
yeah,
people
all
have
the
no idea.
6, 7 types of soluble fiber that interact with each other. Some get formed into others, and so the average consumer needs help, needs education, and needs support.
In general, just eat more fiber.
Yeah, start there, and then you can get into the.
But, even if we think about everyone's into this paleo diet, or what is the diet of our ancestors? And, we killed a big animal, and so it's not. We ate meat.
Yeah.
Paleo diet isn't meat. The paleo diet is fiber. If we look at what our ancestors ate, looking at the diets of certain tribes that might give us an idea of what our ancestors ate, they are gnawing on sticks. They are chewing on, They did not have refined anything, the grains. And so they would have had, like 100 grams of fiber a day. If we look at what the USDA kind of recommendations are, it's like 30, 35. If you look at what people actually eat, it's, maybe 5 or 10 with our processed, sad kind of standard American diet. There is no fiber. Anything things slide down, you need to be able to chew.
Yes.
Not only is that important for dental health.
Yeah.
Right.
Put in a little effort to what you're eating.
Well, and the studies of like those hunter-gatherer societies currently existing, when they look at somebody's microbiome, very, very, very different than like anyone in sort of like the more modern world, and like much more fiber heavy. But I mean, also there are even a lot of organisms that exist in those populations that we just do not see.
Exactly. Wow. Yeah, and variety I think is the other component of it.
That's really important.
Yeah, and in the elderly, it's a natural habit that as some of the people age, their diets become narrow. They buy the same things at the store every week.
Yes.
And they're collapsing their microbiomes. And then if they go into assisted living, they get a program diet and they're not getting the variety
and
in the
diet
they need.
Fiber I can tell you in any of those diets. Yeah.
That's a great call out. And we've mentioned short chain fatty acids, but are there other key elements of the gut microbiome that have been linked to longevity that are clinically helpful?
Yeah, I mean, short chain fatty acids, obviously, with butyrate, spermidine is another one that's made by microbes that we know is associated with longevity. I think, obviously, we talked about vitamin K, and the B vitamins are also made by the microbes, and also just overall immune health. Right? They keep our, and we know immunosenescence, we know inflammation, those are all components of aging. And with a healthy microbiome, you mitigate those as well.
And so we've talked about a lot and covered quite a bit for a very large topic. And I think oftentimes it can be overwhelming for the practitioner to kind of manually go through all of that data themselves. So how does Jona help in this situation to smooth over that workload for practitioners to manage this level of evidence and information and how they translate that to patients?
Well, you're absolutely right, Lexi. Every single month, there are more than 2,000 studies published on the microbiome in PubMed. I don't care who you are.
You don't read them all?
You're not reading them, Dr. Kosinski?
Not possible. And when you also look at the amount of data that comes out of a microbiome study, it's tremendous. I mean, there are more than 11,000 different organisms that have been found in people's gut. But you probably only have 300 of those, and I have 300, and our 300 do not overlap very much. So it's very personalized, very individualized. There's a ton of literature. It's very difficult to sort all of this out as a human being, as a busy practitioner. So where Jona really tries to help the clinician is to automate all of that analysis and provide that information to the clinician so that they can make better decisions for their patients. So what the technology is doing is reading. It's an AI system that reads all of those studies, about 220,000 studies. And then we offer a gut microbiome test, stool sample. We do deep shotgun metagenomic sequencing. We identify everything down to a strain level. And then the AI is going through all of those studies, matching the findings from those studies to the levels that have been measured in the person's gut microbiome so that we can identify those dysbiotic patterns linked to adenomatous polyps or linked to MAS LD or Parkinson's or even just bloating, right? And then in terms of how do we define interventions that can correct those, the AI is also reading the interventional literature on how to change the gut microbiome with diet, lifestyle, supplements, and simulating, what happens if this person goes vegan or what happens if this person goes keto. And then by first identifying the dysbiotic patterns, the AI can try to optimize the set of interventions for that individual, which are really personalized to them, that can reduce or remove those dysbiotic patterns as much as possible.
That's kind of like the magic wand.
Making the complex simple, right?
Yeah, exactly. We have time for one case example. So I don't know if we want to go through one case that you found, Jona, particularly helpful for your patients.
Why don't we have a few cases? The skin one.
Yeah. So there was a young woman who had very serious acne, and she was she'd gone to a lot of doctors. She had tried to figure out different creams and whatnot. And really, nothing was working for her. And when she did her Jona test, there was no pattern in her gut that had ever been linked to acne. However, there was a microbiome pattern that had strongly been linked to hidradenitis. And she'd never heard of hidradenitis before. But once she investigated these symptoms and what hidradenitis contains, she was like, wow, this is actually a very good description of what I've been experiencing.
Wow.
And so then she followed the action plan, made these dietary changes and lifestyle changes, had a huge effect for her.
Wow. That's a great case. Any last clinical pearls we want to share with the listeners in regards to microbiome and stool testing?
Go ahead, Larry.
One thing I would like to bring up is we're in this era of GLP-1s. Okay. It seems like the world is on GLP-1. We have had the opportunity to study patients before and then after a course of a GLP-1. And although they successfully lost weight, they collapsed their microbiome. So I think if there was any final comment I'd like to make is that don't forget about the microbiome when you're treating patients for obesity, because if you stop that drug and you leave this patient unable to make their own GLP-1 because their microbiome has been collapsed, you're going to have more troubles, and they're going to gain their weight back, or they'll have disease, and it's something they should. I personally think anybody who's going on GLP-1 should have their microbiome tested, and that should be certainly tested before they taper off.
We could fill a whole separate podcast episode on that.
We totally could. Yeah, I mean, I think the final sort of always think of the microbiome. So in anything, any disease, sort of don't forget it. You should be thinking about it. Yeah. And any treatment you give, you should be thinking about the effect of that treatment on the microbiome.
Yeah, not just GI, which a lot of people think.
Exactly.
Yes.
Everything.
Yes.
Yeah.
Well, thank you all for being here today. This episode will launch in early 2026. If you would like additional resources, please visit the Innovations in Clinical Implementation landing page, where Jona has uploaded exclusive resources for you to bring to your clinical practice. And thank you all for the discussion.
Thank you.
Your gut microbiome is a complex ecosystem comprised of trillions of microorganisms that have a huge impact on your health. Research on the microbiome is also exploding. No human can keep up with all of this data and research, but an AI system can. Our AI digests the scientific literature and then applies the information to analyze your personal microbiome. We define personalized recommendations designed to optimize your health and achieve your goals.